For people with a learning disability accessing healthcare, it can be really quite a scary experience for them. There's lots of new faces, there's lots of new procedures, they're having to get used to a new environment.
You know, this is a complex area. You may be coming across learning disabilities and as a clinician I've not seen many patients with that, and having a structure to build your approach to that individual I think is very useful.
My name is Julie Kane. I'm a teenage and young adult cancer nurse specialist, and my role is to act as key worker and to coordinate the care for young people aged 16 to 25 with a cancer diagnosis.
So my name is Jeff White, I'm a medical oncologist. The tumour types I deal with are sarcomas, which are rare cancers of connective tissues, and also germ cell cancers.
In my experience, working with people with a learning disability requires a certain amount of adjustment, and the 7 steps is a really useful guide for aiding that. Step 1, imagine being me. Trying to understand or consider what their fears and emotions might be and how that might influence their behaviour. Are there any potential triggers that we have to take into consideration?
What do we need to do to make life and the patient journey experience for that person with learning disabilities as comfortable as possible?
Step 2, find out who and what matters to me. Try to find out as much information in advance as helpful. Using something like a getting to know me tool can be very useful, but also ask and find out who perhaps knows them in other contexts in their life. Step 3, listen to me. Do they use any communication aids such as Makaton or cards or signing? That's really important because we need to know how we'll understand if they are sore or feeling sick or feeling sad or scared. Step 4, give me the information I need in the way that I need it.
We in cancer so much rely on standard verbal communication, standard written tools. It's important to understand what you can do to modify that standard approach in order to get the information to the person with learning difficulties and their carers and families. And it's about thinking what other strategies could be available. So there may be more literature that is less wordy and has more pictures and explanations. And I think we can draw on experience from looking after maybe youngsters in paediatric oncology, where you use techniques like play therapy and role therapy to try and explain what a patient is going to go through, or using pictures and films and videos rather than rely on standard, here's a leaflet and go away and read it type of thing.
Step 5, think about the space that you're in.
Knowing where the patient is coming to, particularly if they've got learning disabilities, can help, so try to be consistent about using the same room so they become familiar with it. If possible, bring the features of their own home or routine into the hospital environment.
I think there's also an element of making sure that you've allocated plenty of time for a procedure. A straightforward blood sample or a straightforward cannula may only take a minute, but you may have to allocate half an hour. And it's important that you've allocated yourself enough time that you're not feeling under pressure, the patient's not feeling rushed, and the likelihood is that you'll have a successful procedure. Step 6, work with others that are in my life, whether that be learning disabilities nurses, district nurses, GP, friends, family, a partner.
It's a team approach within a cancer centre, but also in the wider community, and I think you need to get everyone on board. So having a checklist for who's involved and understanding their roles is really important.
Step 7, giving treatment seems too difficult. Think again.
I think it's really good to give clinicians permission to acknowledge that it is a difficult thing, but also to act as an advocate for a patient with learning disabilities to think again.
Not every approach is going to work for every person, and it's about finding the right approach for the person that you're working with.
And some of these situations can seem quite challenging, but actually when you think about a team approach and getting everyone on board, sometimes problems that seem insurmountable, actually there's a way around it, there's a fix. So it's about making reasonable adjustments.
So the principles of the 7 steps can be used in any environment. They're not prescriptive, they are a guide, and they help us consider all aspects of the person, not just their treatment, and this is what allows us to provide person-centred care.
I think it's well recognised that patients with learning disabilities do have adverse healthcare outcomes, and I think it's important that we try and go some way to addressing those health inequalities by making reasonable adjustments to standard management plans of, in our case, cancer treatment, but it could be any health condition, in order to try and redress some of that inequity.